CTV family. Catch us live on your TV screen.
And this is where it's most hip and happening, ladies and gentlemen. We bring you the brightest youth television show right here on Cape Town TV, the biggest in the country, the biggest in the continent.
We are not hectic 9 million times. I took that. It's right? Hectic 9 million times, Lama. Putting me in things.
Follow us on Twitter, Ekse_live, as well as on Instagram. On Facebook, we're Ekse Live. That number to dial 021-448-0448. We've been talking about COVID-19 since 2019. Go December, and then South Africa did not experience that till Feb, and then
March
lockdown March 2020,
Yeah.
and it has never left our lips and tongues to date. Something exciting happened. Got to go for a vaccine. Everybody was like, hooray, hooray.
Not everyone though.
No, go get a vaccine. We had hope.
Okay.
And then when we got a vaccine, now we start having doubts. I was one of those people who thought, I feel like I'm going to be one of the first in line, bazothatha a vaccine. Until kwabakho doubts, where are you? Where are you standing? Are you doubtful?
I think when they said the vaccine, don't forget, guys, I said I have a question. I haven't forgotten. We're still here. But now talking about doubts and the vaccine. I think before, when people were talking about the vaccine, before it came to South Africa and we were introduced to it, there was a lot of conspiracies and false truths about the vaccine, especially about the 5G, the chip. We're going to be chipped and they're going to be tracking us. Then I was quite skeptical about taking the vaccine. I did not trust it at all. But then again, in my right mind, I knew that these are conspiracies. This is not true. It doesn't make sense as much as you can show me a video of how this is going to work. But then now, fast forward to now, I am hopeful, to be very honest. I'm hopeful in terms of the vaccine, especially with the Johnson & Johnson one that is said to be 85% better, or 85% chances of it working in the system.
Oh, do you have any questions for our nurses? You can WhatsApp them to 060-391-8464. They're still joining us right now. I'm tongue twister viewer as well as Usbongiseni. Thank you for making time for Ekse. Our viewers deserve inyani from all corners because e-ministers might say this, but you are the frontline workers. And on behalf of every South African, I would love to say thank you. We are full of gratitude because you are the ones that wake up in the morning, Tina Sevange COVID-19 every day. So the danger that you come across with every day, impeccable. Do you feel like as frontline workers, vaccine, you are being treated as guinea pigs?
I wouldn't say we are like, if they start with us, we are treated as guinea pigs. But if they they start with us without doing a proper research. As they've done, they said it's a research project on us. We will say that if they do the proper planning, they give us enough information on the vaccine. We are willing to. They can start with us, but as long as they give us the information, they do a proper research on this vaccine.
Yeah, Utu Minister, there's an article here. Health Minister Dr. Zweli Mkhize has moved the calm fears that healthcare workers will be used as guinea pigs, as the government has moved to fast-track the use of the Johnson & Johnson vaccine. The government has already halted the use of the Astra Zeneca vaccine, initially expected to be rolled out to thousands of health workers this week. So even though he's saying that, no, Yongeland is safe, you still have doubts.
They are saying that, everything is safe, but they haven't told us anything. They haven't assured us on that, even though they're just saying, they haven't come to us and assured us and told us, no, this is the vaccine, this is how it works. This is how the process will work. So all you need is them to come to us and tell us the whole planning about it.
But now I just want to find out, because I want to go back to the PPE that we were talking about before we went to the ad break, right? You said that young nurses are not given enough PPEs and you're expected to treat every patient as if they have coronavirus or a deadly disease. I've been seeing a lot of posts making rounds on social media, calling for clinical students, calling for people that aren't necessarily in the industry yet, in the environment yet. Why are we calling, or rather, why are you calling young nurses, clinical students to come in and jump in when the government is simply failing to provide you that are inside with proper PPEs?
So what we can say is that our priority is our people. So anything that we can do to serve our people, we will do that. But the problem that we have is that now, when you get into the facilities, there's no proper PPE. We want to serve the people. That's what we called for, to serve
Yeah.
the people. So any extra hand that might come, then we are willing to accept those hands. But the problem now, it is the PPE that is still a problem in all the facilities, not only in the Western Cape, but
Yeah.
in all the facilities.
But how can you serve if you don't have the proper protection?
That's the problem. The government has shown that they are not taking our people seriously. And I think you could remember from the news when one of the officials said they are asking for extension of the expiry date, and you could see that were led by people that do not know what they stand for. Because how can you ask such a question? And waiting from the government to help us, I think we will wait until. So now we are trying to do things on our own, but the problem is we do not have enough resources to serve our people.
Viewers, Mongseni, let me throw this uncomfortable question. If you guys are not taking the vaccine,
Yeah.
do you suggest that we as the general public entrust the hospitals, sihambe singene siyofaka i-vaccine, kodwa our frontline workers and the doctors and the nurses are not taking the vaccine? What's your take?
When we stand as young nurses about trade union, we are not speaking on for only the young nurses people, but we're speaking for the community.
Okay.
When we say this thing is not safe, it's not that we are rejecting for ourselves, but we are standing for the community.
Okay.
So that's why we said, well, I won't advise you to go get that thing which hasn't shown any activity.
But Lama, to be safe though, with the articles that we read, that thing, they said they shelved it. They not, I mean, from the article, I don't know if this is true. They shelved it. They're waiting for the Johnson & Johnson one that is more effective. That's not going to be 22% effective, and is knows about the new variant that we have in South Africa, well catered for the new variant that we have in South Africa. But with that thing, going back to that thing, people taking it, right? They said it only is effective 22% in your body, and that if you take it, they're going to double shot you. Now, isn't that going to be a problem for the number of people that they catered to vaccinate if they're going to double shot? Because I mean, if they have 10 vaccines, then they double shot me already. 2 shots are coming to me, and then 2 shots are to
Then
you.
it means
That's
5
4.
people.
Yeah, so what's the thing with that? What's going to happen?
We will. I think we will run short of COVID-19 vaccines. But even when they say that there's no proper planning here, you can see even now they're saying the vaccine from Johnson & Johnson has shown 85% effectivity.
Yeah.
But they just put something like just now from their page that it is still in research, and the research will start from the frontliners. And you can ask the question, what if the frontliners get severe side effects from this thing, and who's going to look after you?
Yeah, the bonus Mongseni ufuna uthetha, but let's
Yeah.
quickly go to the viewers and find out if bayayithatha na vaccine or no. And then you get to say what you want to say.
Yes.
Let's check it out.
That this has been a super crazy time, and I'm still tripping about the fact that we are in a pandemic. So anything that I can do to protect myself and the people around me, and to not, see all of these rest in peace posts anymore, just the state of the world, I think. So I definitely would take the vaccine to kind of contribute towards a better and healthier, state of the world. And in terms of the recommending the COVID-19 or the COVID vaccines, I think it's definitely personal choice. I would encourage people to maybe do their research before taking the COVID vaccine. Really like reading up the proper research and not, the what do you call them? The conspiracy theories. But yeah, I think I would recommend my family to take them. I would recommend people to do their research on it, and yeah, to look at it from a different perspective. But I definitely wouldn't be like, you need to take it or you out, bro. But yeah, I would recommend it in a way. Yeah.
Okay, so the question is, would I take the vaccine? And my simple answer is absolutely I would take the vaccine. And for the reason that there's been enough research into the vaccine to prove that it is safe. And considering the fact that I'm not only thinking about myself, but I'm thinking about other people as well, by taking the vaccine, I don't only help myself, but I help vulnerable people around me. I think it would be irresponsible of me not to take the vaccine. So I absolutely would. And I would encourage other people to do it as well. I think it's our responsibility as humans just in general, and South Africans, to take the vaccine. So yes. So my name is Fifi Formson, and I would say keep watching Cape Town TV.
Oh man, we've got brave people there, braver than the nurses that we've got here.
But
in
we haven't
studio.
heard your opinion whether you'd be taking the vaccine or not.
I did say before everything else, before the doubts,
Okay,
before
okay, I remember.
I was wanting to be one of the first people to take the shot. But now that things, I can't pretend as if there are no talks. There
Yeah.
are talks, and of course I'm a human being. I'm gonna have fears about this tattoo. And here they are, Abantu, that are providing us with a health service, and they feel unsafe as well. Viewer, you were trying to touch on, before saying viewers, on effect, but we don't know about its side effects. When are we getting those answers?
Njengoba besisitshilo into yobana i-Johnson & Johnson ikwi-research, but we are very worried into yobana bezawuqala ukuyinikeza kuthi i-vaccine when bengeka conduct enough research around it. But kule sebeqale kubona sebebonisa into yobana no effective, but the research is still continuing.
Yeah. And I think I find it quite interesting that this vaccine that we have now that is shelved was only tested and researched once it got to South Africa. And I was like, isn't this something that they should have done before it actually got to South Africa? Because I believe that Wits University is the one that found out, actually, no, this vaccine won't help the new variant that we have in South Africa. So, yeah, man, this is a very touchy issue and subjects that we're talking about today. And, hey, guys, and I just want to say pray, guys.
Prayer is not a vaccine.
Pray.
We can vaccinate you if you have fatigue about talking COVID-19 only for 2 minutes, and when that is done, you ought to come back to the biggest show in the motherland. We're going to take a quick break. When we return, the panel expands, the hosts expand. Don't go anywhere. There's more.
But don't forget to pray.
Hashtag Talk Thursday. Keep it locked right here on Channel 263. This is Ekse Live.
CTV family, catch us live when